The views and opinions expressed in this podcast are not those of Rain International and do not necessarily reflect the official policy or position of Rain International. Perspectives and testimonies given during this podcast are those of the speakers and not Rain International.
This is the Healthy Soul Podcast. Healthy Soul Podcast presented by independent distributors. Independent distributors of Rain International.
Hi, I'm Janette Smith, and welcome to today's edition of the Healthy Soul Podcast. We're excited to speak with our guests lined up for you today, Dr. Theron Jones, an Atlanta-based dentist who will be discussing the connection between our oral health and other medical conditions. Yes, you've heard about that, but now we're going to dig into that topic a little deeper today. Now, you've probably heard all the buzz about Beyonce on this new vegan kick, and there's books now that are flying off the shelves on the bestseller list. Well, we're going to hear more about this in today's Healthy News Minute with Jody Jones.
Maybe you've been thinking about changing your diet lately, doing the gluten-free thing, or maybe you're going to go completely vegan. Before you do that, talk to your physician, especially if you have a condition that might react to certain foods. Celiac disease, cancer, hypertension, and diabetes don't do well with certain kinds of foods. Changing your diet could kick them into high gear or might even do something worse. So ask your doctor before changing your diet, and together, both of you can keep you healthy and safe.
The Healthy Soul Podcast is being presented by independent distributors of Rain International, the world leader in seed nutrition. Maker of Soul, a naturally delicious 2-ounce drink packed with the powerful antioxidants found in non-GMO seeds. Soul, pure wellness.
And now our illustrious producer, David Person, joins us for more. Yes, I liked how you liked that. I thought it was really interesting when, the whole revisiting of vegan and plant-based diets came to the forefront because Miss Queen Bee started talking about it.
Well, even before Bey, as some people call her, Beyonce, Bill Clinton really made it popular.
That's right.
Because he had this dramatic weight loss, and he is famously vegan. I think veganism has always been with us.
Sure, absolutely.
There have always been pockets of society that have practiced it, but now I guess for some it's a trend.
I think she came out and said she was vegan, and then someone said, but I saw her eating a chicken wing or something. And so I thought it was interesting.
It was a vegan chicken wing.
Right, well, I don't know, because the next time I saw her on like the Today Show or whatever, she's like, now if you can't do it all the way completely like me, I can't, I was like, oh, okay, maybe, But
easing into it.
Right, but I think some of the things Jody talked about relevant and in that start making those small changes, and yield results that way.
Big believer in that. You don't have to take one huge bite all at once,
right.
Pun intended.
Right.
You can do it in small bites.
Yeah, there you go. So I've got the book, We Shall See. We Shall See. Looking forward to your interview you're setting up to do here now with Dr. Theron Jones. We've always heard that you've got to take care of your mouth. You've got to take care of your gums. You got to take care of your teeth. Your teeth are embedded in your gums, which is a straight line to your bloodstream. Very important that we take care of our mouth.
And that's really what he's saying. And he also gets into the idea that the mouth is a receptacle. Mm-hmm. And so because of that, there's a lot of activity. There's a lot that's introduced into the mouth that can then be introduced into the body. So it is very, very important.
All right. Well, let's get into it. Here's Dave.
The Healthy Soul Podcast. Healthy Soul Podcast.
What studies show is that people who have gum disease, what's typically called gum disease, periodontal disease, is usually closely linked to a number of chronic health conditions. Some of those being premature births, heart disease, diabetes, other long-term chronic diseases. It exacerbates the problem, and there are definite links there that studies show.
Do we know what causes this link?
Well, gum disease itself is a disease caused by a combination of things. There's bacteria, there's plaque in your mouth, there's debris from food that's left over, and the sticky substance of your saliva. And that all mixes together to form a paste called plaque. And plaque covers your teeth. Normally, under normal circumstances, normal toothbrushing, flossing, the motions of your cheek and your tongue will keep your teeth relatively clean. But not in every situation. Different levels of oral health exist between people. Some clean better than others, to be frank. So that residual plaque that stays on the teeth allows the bacteria to get under the gum line where the toothbrush can't go. And as that bacteria continues to progress down the gum line, down the root of the tooth, it eats away at the tissue that lines the gum that holds it tightly to the tooth. And as it eats down, it causes little tiny pockets to develop around the tooth. And then you trap more food and more bacteria follows it. And maybe you can see the death spiral as it goes down. Mm-hmm. That progression of periodontal disease is a chronic condition. And periodontal disease is one of the most prevalent chronic illnesses in the country that you'll never hear about. Approximately 75 to 80% of all persons in the country have some form of gingivitis or periodontal disease. Is that prevalent?
Wait a minute. You said 75 to 80%?
75 to 80% of all people in this country have some form of gingivitis, which is a mild form of inflammation of the gums, down to periodontal disease, where you get a loss of tissue attachment and loss of bone around the tooth.
Is this something that is immediately discernible to the person, or are you saying that many of us are walking around with this and we don't know it?
Many of us are walking around with it and not knowing it for two reasons. One, we do not go to the dentist regularly as we should. Dentistry is a prevention-steeped practice. It is built on going on a regular basis to catch things when they're small before they grow into large things. And people do not go to dentists on a regular basis. Twice a year is normal, every 6 months. And we don't go to dentists on a regular basis. There's a myriad of reasons for that. There's not as much coverage for dentistry as there is for medicine, let's say, and benefits covered by the job. It is not as well known. It is not referred to by MDs as often as it should be. But the second part of that is men in particular. Men do not go to the dentist or the doctor, period, as much as women do. And so we don't catch it early, and it progresses to a more aggressive, more chronic phase. And by that time, you're past the post at that point.
So if many of us are walking around without knowing that we have gingivitis or something worse, what would the symptoms be?
I mean, outside of not going to the dentist on a regular basis, some of the signs that will pop up to you. A lot of people will complain of having swollen or red or tender gums, gums that bleed easily when they brush. They have a bitter taste in their mouth that's usually pus that's undetected. Chronic bad breath. No matter what they do, they consistently have bad breath, in the back of the mouth. There's a buildup of hard brown deposits around the tooth, and it seems like there's something stuck on the tooth that can't come off, and that's plaque. The more extreme cases, people will feel loose teeth, or they'll feel their teeth hurt when they chew, or the teeth will feel like they're moving as they chew. If you're wearing dentures, the dentures don't seem to fit as well anymore. Those are all signs that your teeth are losing the bone structure and that the tissue is inflamed with bleeding and swelling and pus.
Wow, that's sobering.
It is, and it's hard to tell people that, and people think, well, I don't feel any different. And then you look in their mouth, and it could be an absolute wreck.
Wow. Okay, so obviously, just not even factoring in cardiovascular disease, you're saying that we as Americans need to do a better job of maintaining our oral health. And you recommend twice a year? That's what you're saying, twice a year?
The person who is not having any overt problems or any lengthening symptoms would come twice a year, every 6 months. And we'll check for cavities and we'll check for other things. Someone who has periodontal disease will need to be seen more often every 3 months. to address the periodontal concerns and to clean around the teeth and clean the tissue so the tissue has a chance to actually heal. It being a chronic infection, inflammation is your enemy, and the bacteria hangs out under the gum area, and as it penetrates the tissue, that oil-specific bacteria gets into the bloodstream, and it's called bacteremia, when you have bacteria in the bloodstream. Well, then it travels around the body, and that bacteria then puts out specific proteins that causes inflammation in the blood vessels, and that's where the link comes between cardiovascular disease and oral disease. That's where the link comes from. Let's
talk just a little bit more about what should be done outside of regular dental visits. Is there some regimen people ought to be doing at home? Are there certain foods or drinks that people ought to avoid or that they ought to make sure they consume in order to help their oral health?
Well, here's the catch. There's nothing specific that's daunting that's required by dentistry. Dentistry is awfully simple, and oral health is awfully simple. We obviously don't recommend, excessive sugary drinks. We don't recommend excessive spicy foods, things that will change the bacterial flora of your mouth, like spicy foods. But the actual cleaning part, the home health care part, is all that's really needed, no matter what your diet is. We've been told our whole lives to brush and floss. Well, actually, you have to go to dental school to realize that that's not actually correct. You want to floss first, and then you want to brush away what you flossed up.
Oh, really?
Yes, you want to actually floss first, and you don't want to floss all down in between the gums. That cuts your gum tissues, and it actually increases inflammation. So we've been taught to floss down one side of the tooth and back up the other side of the other tooth. That cuts your tissues, and it increases inflammation.
Okay.
That's actually the wrong way to floss. We've been taught our whole lives that. And that's actually wrong. You want to floss only between the contact points where the two teeth touch, because that's where you're trapping food. And as you pop through, pop back out, pop back out. And then you brush away what you just flossed up. And then you rinse through good with a dentifrice such as Listerine that rinses under the gum line to flush out the bacteria and food that you can reach without cutting it with your gum, with your floss.
You really have raised some things that are really new to me. This whole idea of flossing first, I've never heard anybody say that. That's new to me. But it makes sense. I get the logic of it, definitely. Okay, so Dr. Jones, then let's talk a little bit now about this, a little bit more about this connection between oral health and cardiovascular health. What particular risk is poor oral health putting our hearts at?
If you look at the different studies that are done, they all focus on the link between chronic inflammation and how that affects different parts of the body: kidney disease, diabetes, premature births, cardiovascular disease, stroke. All those things are exacerbated by the chronic inflammation that comes about by the bacteria that's laden in periodontal disease. So the link is there, and I want to be careful to use the word link, because the studies are still ongoing to show a causative factor. And those are two different things. I don't want to get too scientific-y on you, but the link is clearly shown that people who have periodontal disease are much more likely to have premature births. This is 74% higher in folks who have periodontal disease to have premature births. It is 20 to 40% higher for someone to have cardiovascular disease and diabetes if they have periodontal disease also. So the link is there, and it's been proven, it's been shown. What hasn't been proven is, does periodontal disease cause those things, or do they only make them worse? And it seems like a very academic argument, but it's important, because if someone is not in good health overall, that changes the dynamic for how you treat them.
The Healthy Soul Podcast, presented by independent distributors of Rain International.
Interesting, Dave. What were your ahas? Because, I mean, some of this we kind of knew.
Mm-hmm. Well, this may sound kind of crazy, but one of my ahas was this whole idea about, and this is going back to, mouth care basics 101.
Right.
You floss and then you brush. The way I was raised, you brush and then you floss. But he was saying, no, the reason that you floss first is so that you can,
break up that stuff.
Get that stuff out of there that's between your teeth, and then you brush it away and expel it. And I was like, okay, that's logical.
Right.
But then he went on, to make the deeper and more significant connections between, poor oral health and everything from premature birth weights to heart disease and even diabetes. Yeah. And it all stems again from, the very basic premise that if you don't keep your teeth clean, then what happens is you allow bacteria to grow. Bacteria that grows and then gets into your bloodstream, because it also weakens your gums. And I'm not going to get too deep into it because he's the expert, I'm not. But there's a very simple process here that if you just play it out, you're like, oh, okay. And then that's how it can lead to these various problems.
Right. And I'm so interested as they learn more to kind of follow this. I think some things kind of fall off our radar, except for when we get ready to go to the dentist, then we're all about it, Right. But I'm going to keep this one on my radar. Very interesting stuff. Let's get back to your interview. Want to hear more about the idea of our medical doctors working more closely with dentists.
And he definitely gets into that, and it's not, his take. Well, you'll hear his take. I'll just let him tell it.
The Healthy Soul podcast.
When I lived in Massachusetts, I actually partnered with the American Cancer Society to actually go out and teach groups of MDs how to spot oral cancer in the mouth and when to refer their patients to a dentist. Because they would look right past, when you go to an ear, nose, and throat doctor, you go to the doctor, they put the tongue on they put the little popsicle stick on your tongue, and they say, they are. They look right to the back of your throat. They look right past your mouth. You ever notice that?
Well, yeah. They put the tongue depressor in, and you're right. They don't spend any time.
They say they are, and they look right to the back of your throat. They look right past all of the tissues in your mouth. And the ironic thing is, what we try to teach MDs is that most of the systemic problems you have in your body, they have an oral manifestation. They show up in the mouth in some kind of way.
Let's go back to the premature births for a minute. A woman comes in, she's pregnant, her teeth are already in bad shape. There's really nothing that can be done, or her oral health is poor. There's really nothing that can be done at that point in terms of the impact that it may have on the baby, right?
Not necessarily true. What is found by a lot of the links are the further along and progressed you are in your pregnancy, the greater the need is for oral health care. And right up until the third trimester, and if a woman can come in and get very good, aggressive oral hygiene treatment in that third trimester, and to clean up and have those tissues begin to heal, the load of bacteria in the bloodstream drops dramatically. And the subsequent inflammation that bacteria will cause drops dramatically. And it has an immediate effect on the health of the baby. So a lot of that can be addressed even late in pregnancy. Okay. It's never too late to get a woman in.
But it does sound as though ideally this is a conversation that doctors, OB-GYNs or dentists or whomever ought to be having with women even before they get pregnant.
Exactly. It should be part of the prenatal treatment and so forth. Some doctors will do it, but by and large, a lot of them won't. And it's just because they have so many other things to cover with that woman. Having a dentist come in and say, hey, add this on your plate as well, maybe it's just too much for them. I don't want to presuppose, intentions, but it's not widely shared with the patients. To my knowledge, it's not.
We have gotten at least I'll speak for myself, I have gotten today from you a really interesting primer just on how to rethink oral health, starting with the fact that, flossing should be done first. I mean, I've never heard that. And then you brush away what you flossed. I mean, that now that I hear you say it, that sounds like a no-brainer, but like you said, we weren't taught that.
We're not taught that.
Yeah.
And the moniker brush and floss, it's the moniker you hear, brush and floss, brushing first and then flossing.
Yeah.
It's not the real way to do it. Every bite you take, the only way the food gets over there for you to chew it is the tongue has to push it over there.
Mm-hmm. So
every single bite.
So you said that 70 to 80% of Americans are walking around with either some form of gingivitis or some form of periodontal disease. If you could wave a magic wand and prescribe a cure for America, what would it be?
For any particular disease?
Well, I'm saying to help Americans improve their oral health overall, to see that percentage of people with gingivitis or periodontal disease drop. What would you do? What would you prescribe?
Interesting. I think it would have to start with better diets, less fattening foods,
okay,
more fruits and vegetables. A healthy body will lead itself to healthy outcomes.
Mm-hmm.
So the aspects of chronic infection in different places, a lot of times, are triggered by poor health decisions to begin with.
Mm-hmm.
But if I had to choose one, it would be better diets, because that starts everything in the body.
Okay. If you had to choose more than one, if you had the liberty of choosing more than one, in addition to having a more healthy diet, what would you prescribe?
A more comprehensive healthcare system, one that ties together all our different specialties to showcase the fact that everything is connected. The fact that there is such incredulity, and you showed it yourself, with the link between oral health and the rest of the body. For dentists, we kind of chuckle at that because we're like, the mouth is connected to your body. It's all a part of the same body. Mm-hmm. So it's not like some outlier out here somewhere. Your mouth is very important. You eat through your mouth. You breathe through your mouth. Things into your body mostly through your mouth. So it being the portal to your body, it would seem intuitive to us that would be a showcase for everything that's going on in your mouth, in your body. Excuse me. Mm-hmm. So the mouth is connected to the body just like everything else is. So it's one unit. And if we taught holistic healthcare, we would get better coordination of our health system, and we would have better outcomes. Right now, we have a tertiary system now where you only show up to the hospital if you're sick. Well, by that time, you've not done so many things that could have prevented that to get to that point.
Hmm. Well, that makes a lot of sense, what you've just said. That makes a lot of sense, and it kind of makes me wonder or question just why our medical system is set up the way it is, because I think you're right, it ought to be more integrative, not just as it relates to doctors and dentists, but I would even argue, dietitians and naturopaths and, chiropractors. I think it all ought to be structured so that it benefits not, a hierarchy of disciplines, but that it really benefits the health and well-being of the people of our nation.
The hierarchy word that you just used is extremely important because traditionally, healthcare was doctor-centric. It was based on the doctor. The doctor said, do this, you did that. If your doctor said you did do this, you did that. And everything was based on what the doctor did. There have been a lot of interest involved in healthcare. That's why it hasn't been focused on what it should be focused on. There's a lot of pushback when it comes to trying to tell doctors what to do with the patient. They've always had this carte blanche. I get to determine what's best for my patient, and no one questioned that. So now that paradigm is shifting to now we're looking at a team of folks who can decide best what's best for that patient. Mm-hmm. And that shift is going to result in a lot of preventive medicine, We'll see less tertiary care because more people are going to have health insurance. They're going to go to the doctor on a more regular basis and get the preventative care and not just wait till they're sick to show up in the emergency room. So that aspect of healthcare has to change.
The Healthy Soul Podcast, presented by independent distributors of Rain International.
More great information. It's really a paradigm shift in our thinking.
Yeah, that's what he's advocating. He's saying that there needs to be more of a teamwork approach, that doctors and dentists need to work side by side because of these connections. And again, to be clear, just so nobody forgets, he's not saying that there's an express causal link. What he's saying is expressly a causal link. What he's saying is that there is a clear indication that when you have oral health issues, that some of these other things can follow. More studies need to be done to determine whether or not there's a direct causal link between, let's just say gingivitis and, birth issues
effects,
or diabetes or something.
Right. And we know that preventative care is key.
And it's good for everything.
That's right.
We should have a preventative mindset about everything as it relates to our health.
Absolutely. Great interview. Thanks, Dave.
The Healthy Soul Podcast is being presented by independent distributors of Rain International, the world leader in seed nutrition. Maker of Soul, a naturally delicious 2-ounce drink packed with the powerful antioxidants found in non-GMO seeds. Soul, pure wellness.
Here's Dr. Jeffrey Wright, naturopathic doctor, to tell us more.
Seed-based nutrition is a good thing. Now, this is something I already knew and practiced. I've been recommending that people eat nuts and seeds, like flax seeds and sesame seeds and other seeds. I've been recommending people eat them for a long time. I've been recommending if you eat grapes, you should chew up the grape seeds. You should buy your grapes with seeds and chew up the seeds as well. But as I studied the research on these seeds, I became more and more impressed at what they could do. Oh, sure, I heard rumors that black cumin seed was pretty much good for anything but death, and I thought, I don't believe anything's good for everything but death. But as I started researching it, I started finding, wow, there are people who are researching this. They're in the cancer world. There are people who are researching black cumin for treatment of cancer and getting some results. Not all good, but many of them better than what they expected. And some people who were doing research with black cumin and cancer and chemotherapy and getting good results. And I was continuing to be more impressed. And I started putting people on this product as an adjunct to their regular medical therapy. And we started finding that they were improving faster than what I would normally expect for them to do on the regular therapies. I have patients on autoimmune diseases, one MS and one low thyroid. And I started seeing their numbers change. I started seeing them having more energy to exercise and more energy to think and process and having less downtime, less traumatic time, less symptomatic time. And I gradually became a fan, and I continue to see success with it.
The Healthy Soul Podcast is produced by David Person, engineered by Damian Malone, production administration by Sylvia Wilson, post-production assistance by Jeremy Person. Interviews are recorded in the studios of Praise 90.1 FM WJOU in Huntsville, Alabama. Music heard on the Healthy Soul Podcast was produced by David Person. The executive producer of the Healthy Soul Podcast is Hallbrook Polite. Check out the Healthy Soul Podcast page on Facebook for future episodes of this podcast and for updates. You can also find out more about Soul and Rain International on the web at www.lifeconcentrated.com. I'm Janette Smith. Remember, keep your soul healthy.
The views and opinions expressed in this podcast are not those of Rain International and do not necessarily reflect the official policy or position of Rain International. Perspectives and testimonies given during this podcast are those of the speakers and not Rain International.